Hey guys, welcome back to another video. Welcome back to pregnancy series. Welcome back to this YouTube channel. If you have not subscribed, kindly subscribe. If you're watching this video for the first time, please click the notification bell so that you get notification every time we upload a video. Like my video, share, comment, and don't forget to subscribe. So today's video we are going to talk about stillbirth. I know most of you have been asking me to talk about it, and today is the day. Now, stillbirth is when a fetus dies after a mother is 20th week of pregnancy. Now, the fetus may die in the uterus weeks or hours before labor. Now, rarely the fetus may die during labor, although prenatal has drastically improved over the year. The reality in stillbirth still happen, and stillbirth still happen and often go unexplained. Now, a stillbirth is classified as either early stillbirth, as either an early stillbirth or late stillbirth, or term stillbirth. There are three. They are classified into three terms: early stillbirth, late stillbirth, or term stillbirth. Now, these types are determined by the number of weeks of pregnancy. So, early stillbirth, the fetus die before 20th weeks and 27 weeks. 20 to 27 weeks. The fetus die before 20 weeks. Now, late stillbirth, the fetus die between 28 weeks and 36 weeks. And then term stillbirth, the fetus died 37 weeks or after 37 weeks. How common is stillbirth? Stillbirths occur in about 160 birth per year. 1 in 160 birth per year. Did you get that? Stillbirths usually occur stillbirth usually occur 1 in 160 birth per year, which means if 160 mothers are pregnant, one of them might get stillbirth. Now, let's look at who is at risk of getting stillbirth, or who is at risk of giving birth to a baby who is dead. Now, a stillbirth can happen to a pregnant people of any age. There is no specific age that we can say that a stillbirth will happen. Background and ethnicity can also play a role. Now, they can be unpredictable. Yes, they can be unpredictable. You cannot tell when it will happen. So this group of people are the people who are at risk of getting stillbirth. A mother who is smoking just before getting pregnant or during pregnancy. If you smoke, you drink alcohol, or you use recreational drugs, you know them, cocaine, you are likely to get stillbirth. If you get pregnant after 35 age 35 and above, usually have a lot of risk. So I'll advise ladies who are planning to get pregnant, kindly get pregnant before 35 years, because after 35 years there are so many risks that you are likely to suffer from a specific condition: stillbirth, high blood pressure, among other conditions that I will talk in pregnancy series. Now, so somebody who's getting pregnant after 35 years, that person is at risk of getting a baby who is dead. Having poor prenatal care also can put a mother at risk. For example, this woman got pregnant and has never gone for prenatal care, did not go for antenatal care. This person is at risk of getting stillbirth, because maybe this person can get anemia along when she is pregnant, and maybe without knowing, anemia can cause stillbirth. So poor prenatal, poor antenatal can also put you at risk of getting stillbirth. Malnourished mothers can also get stillbirth because of lack of nutrients. Now the baby, what will the baby eat if you yourself you don't have enough nutrients in your body? Now if you are malnourished, you are advised to get to attain some weight, or to have a standard weight, so that after that is when you can get pregnant. So that one is also another problem that can put you at risk of getting stillbirth. They say black people are at risk of getting stillbirth. I don't know the reason why. Those who are having multiple babies, multiple pregnancy, multiple babies, multiple births. I mean, if you are carrying twins and maybe twins, triplets, you are at risk of getting stillbirth. If you are having pre-existing condition, like for example, if you are having DM, or you are having HTN or hypertension, you can get stillbirth. Those who are obese, they are at risk of getting stillbirth. So let me differentiate between miscarriage and stillbirth. Stillbirth happen is loss of pregnancy after 20th week of gestation or pregnancy. In miscarriage happen before 20th week of gestation or pregnancy. Now those are the difference. One is happening after, one is happening before 20th week of gestation. Now let's look at the causes of stillbirth. Now the causes of stillbirth is vital, not only for the healthcare provider to know, but the parents also have a lot of problem on this. Now, but the most likely causes of stillbirth are problem with the placenta or the umbilical cord. Your placenta is an organ that lies in the uterus when you're pregnant. Now, through it and the umbilical cord, the fetus get blood, the fetus get oxygen, the fetus get nutrients, among other functions. So any problem with the placenta or umbilical cord, and the fetus will not develop properly. Have you heard? If you have any problem with the umbilical cord, if you have any problem with the umbilical cord, if you have a problem with placenta, then the fetus will not develop properly, or you will have stillbirth or even miscarriage. Now, the second cause is preeclampsia. Preeclampsia is high blood pressure and swelling often happen late in pregnancy. If you have preeclampsia, you have twice risk of placenta abruption and stillbirth. You see, if you have stillbirth, you are at risk of getting two conditions. We are at risk of getting placenta abruption, which is also dangerous when you are pregnant, and you are also at risk of getting stillbirth. So preeclampsia is also another cause of stillbirth. Then if you have a lupus is a person who is at risk of having a condition. If you have a condition of blood, lupus is a condition of blood. Now if you have such condition, you are at risk of getting stillbirth. If you have clotting disorders, a person with clotting disorder likely are likely to get stillbirth. Now we also have the pregnant person with medical condition. Other illness can sometimes cause stillbirth. Now the list include diabetes, thyroid diseases, among other bacterial diseases can also cause stillbirth. We also have bacterial infection. If you have any bacterial infection, you can also have what? Stillbirth. We have lifestyle, like I said, those who are at risk, those who are smoking, those who are drinking alcohol, those who are using some of the recreational drugs, they are at risk of getting stillbirth. Another one is birth defects. So birth defect is a congenital abnormality. Maybe you are having a baby that is having a specific congenital abnormality. You can have stillbirth. Infection, like I have already said, you can also get stillbirth. Trauma when you are pregnant, you can also get stillbirth. So what physical symptoms does the mother have after stillbirth? This is another question that you will ask yourself. What are the physical symptoms that a mother have after stillbirth? If you have a fever, bleeding, chills or pain, be sure to contact your healthcare provider right away, because this may be signs of infection, and infection can lead to stillbirth. So if you have fever, bleeding, chills, pain, abdominal pain, you contact, or you go to the hospital. Let me just say you go to the hospital, because contacting healthcare providers in Africa is a problem. You just go to the nearest hospital and you will get help. Now, let me answer this also. Does a stillbirth cause infertility? No, a stillbirth does not cause any infertility, and it does not indicate that there is a problem with you. It can just happen. Maybe you only had a problem with the placenta. Maybe you had congenital, the baby had congenital abnormalities. It doesn't mean that you will have infertility cases. So stillbirth does not cause infertility. So immediately you have been diagnosed with a stillbirth, now the doctor will decide, or the nurse, or the healthcare provider, or the midwife will decide which type of labor you will undergo. You can be induced, they can induce labor if you are at term, and maybe they have seen they've seen that if you go for cesarean section, they will be just causing trauma and nothing best. So they will induce labor and allow the nature to take its place. You will just give birth a normal birth, but you will give birth to a dead baby. Also, they can allow a natural birth, like they can allow labor to start by its own. They can allow labor to start by its own, but they prepare you psychologically about what will happen, about the fetus that you will receive. And also they can decide that you go for cesarean section according to the condition. Maybe you are having a severe preeclampsia, you are having other conditions that can put your life at risk when you go to when you give birth naturally, or if maybe they induced labor. So they will decide you go for cesarean section after that. So after they've diagnosed with, if you have been diagnosed with stillbirth, the doctor is the one who will decide which type of, they will do next. About the prevention of stillbirth, there is prevention, because I said somebody who is at risk of getting stillbirth is somebody who is taking alcohol, somebody who is drinking, smoking. So you can avoid those. So usually stillbirth cannot be prevented sometimes. It often occurs because the fetus wasn't developing normally, and generally improving your health include, if you improve your health, including managing maybe pre-existing condition and life changing or lifestyle changing, you can prevent it. If you go for preconception care, and you have prenatal care, antenatal care, antenatal care, then the risk is always reduced, so you might not get a stillbirth. And remember, I said it is just 160. If 160 women are pregnant, one person might have a stillbirth. So it is not common. It is not common. It is, I can say it is just by bad luck, maybe. For those people who are drinking alcohol and those people who are smoking, you should avoid those so that you don't get stillbirth. Yeah, those are the things that you can do. And if you have a pre-existing condition, also you can manage the condition before you get pregnant, and then you will not have problem during a pregnancy, and you might not even get stillbirth. So I think I've reached the end of the video. If you haven't subscribed, please kindly do so. Please do so. Subscribe, like my video, share, comment. Don't forget to turn your notification bell, and let's meet in the next pregnancy series. Bye.